Hello everyone, welcome to Pharmaceutics Recalls discussion. Question number 21. Certain tablets contain micronized drug particles because the options are coarse particles irritate the gastrointestinal tract, they have higher bioavailability, tablets prepared from this form disintegrate more rapidly, they are intended to act locally, they enhance pinocytosis. So here the correct answer is option B, that is they have higher bioavailability. So this micronized is a term used in the pharmaceutical industry to describe the size of a drug particle. In general, micronized particles are usually less than 50 microns, but in the pharmaceutical industry, they are generally less than 10 microns. So a micronized drug particle is about 4 to 10 times smaller than a conventional drug particle. Reducing the particle size of a drug helps it to dissolve and absorb more easily into our body so that it can reach its site of action. That means it will improve the bioavailability of a drug. Next question. The major use of titanium dioxide in pharmacy is in. The options are sunscreens, antacid tablets, capsules as a diluent, effervescent salts, emulsions. So here the correct answer is option A, that is sunscreens. That is the major use of titanium dioxide is in sunscreens. Titanium dioxide in proper concentration can totally block the burning rays of the sun. In the pharmaceutical industry, titanium dioxide is used in most sunscreens to block ultraviolet A and ultraviolet B rays. It is also commonly used as a pigment for pharmaceutical products such as gelatin capsules, tablet coatings and syrups. In the cosmetics industry, it is used in toothpaste, lipsticks, creams, ointments and powders. It can be used as an opacifier to make pigments opaque. Next question. Constituents of oral rehydration salts include all except. The options are sodium chloride, glucose, potassium chloride, sodium citrate, magnesium hydroxide. So here the correct answer is option E, that is magnesium hydroxide. Magnesium hydroxide is not a constituent of ORS or oral rehydration solution. So here you can see the constituents of ORS. Sodium chloride 2.6 gram per liter, anhydrous glucose 13.5 gram per liter, potassium chloride 1.5 gram per liter and trisodium citrate dihydrate 2.9 gram per liter, and the total weight is 20.5 grams per liter. Okay, so now let's discuss about the role of each of the constituents in the oral rehydration solution. The first one is glucose. The glucose facilitates absorption of sodium and hence water. Then what about the sodium and potassium? It will replace the loss of these essential elements in diarrhea and vomiting. Then citrate corrects the acidosis that occurs due to diarrhea and dehydration. Trisodium citrate has the following advantages over sodium bicarbonate. It includes, it will improve the shelf life of ORS. It helps in reducing the stool output, probably through a direct action on the intestinal mucosa, enhancing the absorption of sodium and water. Question number 24. Carbomers may be included in a topical product as. The options are antimicrobial preservatives, buffers, penetration enhancers, sweeteners, thickening agents. So here the correct answer is option E, that is thickening agent. Carbomers are polymers with a number of carboxy groups present. So when the pH of a solution containing the carbomer is increased, there will be a significant increase in viscosity. Thereby it acts as a thickening agent. Question number 25. Methyl paraben is an ester of. The options are benzoic acid, para-hydroxybenzoic acid, para-amino-salicylic acid, propionic acid, benzyl alcohol. So here the correct answer is option B, that is para-hydroxybenzoic acid. Methyl paraben is an ester of para-hydroxybenzoic acid. This methyl paraben belongs to a group known as parabens. They are commonly used as a preservative in the food, cosmetic and pharmaceutical industries for over 50 years. The chemical formula for methyl paraben is C8H8O3. It is also found naturally in fruits like blueberries, where it has antimicrobial activity. Methyl paraben is completely absorbed through the skin or after ingestion, and it is hydrolyzed to para-hydroxybenzoic acid and metabolites and are rapidly excreted in the urine. So with this question, we have completed today's recalls discussion. Thank you for watching this video. Let's see in the coming video session.